Dr. Dallas, thank you so much for joining me on Misunderstood. How are you?
Great. Thank you for having me.
Of course, I'm so excited that you're here because I have a zillion questions for you. First, I want to get into how you got into medicine and into this field in general.
Yeah, that's a great question. I grew up in El Paso, Texas, and obviously I'm practicing here in Dallas. And so, most people are going to end up going to college. I went to the University of Texas in Austin, and from there they'll go to medical school. Went to medical school in San Antonio, and that's kind of where you really get into starting to see all the different specialties. You got to learn all the basics and the foundations, but then you kind of start going through all the rotations, medicine, OBGYN, but I really took an affinity towards surgery. And so that's one of the tracks I sort of ended up doing. And one of the traditional routes to do plastic surgery is through general surgery. So I did 5 years of general surgery in Chicago and then kind of completed a plastic surgery training in New York. And so what I really liked about surgery was just the fact that you can get in there and oftentimes the things that you do, you're kind of seeing this immediate response, right? It's not like you're treating someone who's got diabetes, putting them on a medication, then you got to wait, like 3 months to see if they actually do the things you want them to do. And is the medication working? If you do, let's say, breast reconstruction, you see what you're doing right then and there. So there's a really gratification to be able to see those immediate results. And also, patients can also see for themselves, these are usually, when I do cosmetic surgery, and that's what I focus on, breast and body below the neck, they're seeing that almost immediately. And so just kind of seeing them when they look at themselves for the first time, I really enjoyed that sort of, it was gratifying to me to be able to give that to someone, to see them happy about this change in their body.
Mm.
And yeah, so that surgical aspect, immediate results, and giving people something they can be happy about,
Yeah.
that's what I really enjoyed about the plastic surgery portion.
So it's really interesting, way back when, I think that plastic surgery was very taboo. I mean, a
Mhm.
little bit it is sometimes. I mean, I don't know why people still pretend that they haven't had it when it's obvious
Right,
that they have.
right.
But way back when it was quite taboo. And now it's like the more you do on social media, I
Right.
would think the better you do and the more well known you are. And that's how you really book patients because people like to see that before and after. They like
Yeah.
to see what's going on in the surgery room. And you're really good at that and you're known for that. And I think that's fantastic. Has that helped with with your practice?
No, absolutely. I think social media really came on the scene probably about 10 years ago. Is when you started people using it a little bit more and more.
Mm.
And there's only a few people in the and across the nation that were really doing it with any frequency. You have your Dr. Miami's, who I know very well. He's a good friend of mine, and he's actually the one who kind of said, "Hey, man, you should really look into doing this." And went down there and he kind of showed me what he was doing through his social media and started really going with my Instagram, Snapchat, that sort of thing. But it really opens the doors, like you said. It was taboo, 15, 20 years ago. You never knew someone had a facelift or they wouldn't tell you. Or
Right.
it was something that you just thought was this mysterious magic that was happening behind these doors. But we literally like opened up the doors to the operating room to allow people to see what we're doing. And so it's amazing that a lot of women really like watching a tummy tuck or a breast augmentation because one, you're kind of demystifying the surgery of it. It doesn't seem so scary when you see it. And it's not so secretive. We're not doing anything crazy in there. We're just following basic principles, being safe and doing those things. And when they see that, they first go, you know what? I could see myself doing that.
Mm.
I could see myself in that person because I look like that person getting that tummy tuck or that breast augmentation. And I think the other thing maybe that you didn't really touch on as much is that not only are they seeing it, but they actually get to see that surgeon's personality, right?
Mm.
They see me talk about it. If you were to say follow some of my social media every day before surgery, I'm going and showing, hey, good morning. This is my pre-op picture. This is our patient. She's lost over 100 pounds. She's had 2 children. She hates all that loose skin there on her tummy. We're going to do a tummy tuck and remove all the skin with the incision. I'm explaining the procedure and
Mhm.
they're seeing how I do that because it's exactly what I do in my pre-op consults. And so they start to feel comfortable. And you don't know how many times people come in and they feel like they've already met me before
Right.
because I talk so much about it. So they feel comfortable, but they also understand understand, the things I'm going to be doing. So yes, it's a great way to kind of open up the doors to your practice, but also to the personality of the surgeon themselves.
So the standards of beauty have really changed so much over time.
Yeah,
And I think that, so many people look to what celebrities look like to find
sure.
what they think is beautiful at the time. So like with this guy, Dr. Miami, I know he does a lot of Brazilian butt
BBLs.
lifts. Yeah.
Yeah.
And butts are a big thing, especially in Miami. But celebrities, I think for a while went with the very big butts. I'm curious what you're seeing. I'm seeing here in Florida, it's a little more natural. Is that something that you do a lot of?
I do quite a bit of those BBLs. And so, and I agree with you in the sense that I'm probably seeing some of the things that you're seeing and also talking to colleagues that, when it first came onto the scene, really, kind of big was probably like 5, 8 years ago,
Mm,
especially Jennifer Lopez, showing off her dress at the Emmys with that green dress, really showing that big bottom.
right.
So people were really interested. How do I get a bottom like that? And there were a few surgeons here, a few surgeons in South America that were transferring fat into the bottom, but they were doing quite a bit of fat. The idea was to put as much fat in there and get the biggest butt possible. And you see the Kardashians and these people who have very large bottoms. But you also see this trend probably in the past few years that people are starting to kind of come down for this very large artificial look and having a more natural, what I call more athletic type of look. So the reason why I think that some of these really big BBLs look abnormal is because they put so much fat on the sides, right? We
Mm,
all know that a wide butt like that is unnatural, and our eyes always pick it up. And when they look really round, you just know it's artificial. Now, when it's rounded on the back, that's okay. That means that, okay, could she have been working out? That's where the gluteus maximus is. Sure, you could work out, maybe get a large bottom like that, but the side has really made it look kind of artificial. So what I do in my butts, I tell people I'm going to take the fat that I see and I'm going to put probably 80% of it in the central back portion for projection. I only put like maybe 10 to 15% on the sides, really just to take away the hip dips and make it a little bit straight or a little bit round. To me, that looks much more natural. That looks like someone who's been in the gym working out. Because if you look at these Olympic runners, because the Olympics are going on right now, you look at all these women who have nice butts, guess what? They got no hips, right? The
right.
sides,
I
because
like
there's,
that hip dip. I think it looks
yeah.
like very athletic.
Exactly. And that's because there's no muscle there. That's why you can't build up muscle on the side. Those are all tendinous bands. So when you build muscle up in the gym and what they're doing, they're seeing this big projection, but nothing on the side. So when I do a BBL and what I've seen other people do and my Florida colleagues, we're all putting a lot less on the side to give more to athletic natural shape. In a shape that's going to last. If you really look at these butts that were done 10 years ago, they don't look that good anymore
Right.
because
Yeah.
the skin is starting to sag and you can see it. I can see it. We know who's had it and we know those butts are starting to sag and they're all coming back, trying to figure out how we lift them back up, how we get rid of the fat. And so we're seeing the second wave of people who were in that first wave of BBLs that we're trying to take down a little bit. So that's the
And I'm
trend I've been
curious,
seeing.
is it like I've been seeing all these women that have very small waists that are unnatural, and then the butt almost looks bigger, probably because the waist is smaller. But is that where you're getting most of the fat from?
Yeah, I think most, even very fit women, men will carry more weight on their muffin tops, right? Those
Yeah.
little love tie, those little muffin tops. We carry a little bit more there, and despite us working out, we tend to still, gather a little bit more there. So I would
Mhm.
say that's probably the best place to take from. Now, obviously, you got the tummy. I see a lot of women with some fat on the bra roll area, kind of coming up around their bra roll. They don't like the way the bra sort of pinches the skin and it folds over. We
Yeah.
definitely want to go after that. But when I think about doing it, I really want to take it comprehensively all the way around. Because if you just go for the muffin tops, what happens is you can make a small waistline, but guess what looks big is their back. They look like they have a big back, especially if
Oh,
they gain weight. So I like to really liposuction comprehensively all the way around. But yes, the flanks are perfect areas to take from because one, it looks great to snatch that waistline because the illusion, like you said, the illusion, small waistline, bigger bottom, even though you might not have done anything. As long as you pull in the waistline, they look like they have a better shape. So that's one of the illusions of a BBL. Sometimes just good liposuction is really going to do 90% of the work.